Children who have problems with language, social interaction, and their ability to communicate with others have been diagnosed for many years as having an autism spectrum disorder. In the past, the diagnosis which was used was called pervasive developmental disorder, PDD. And that's the category that's used in the DSM-4, Diagnostic Statistical Manual, 4th edition, and it's revised. So it's called the DSM-4 revised. In that category, there were several categories of PDD. Number 1 was called autism. Number 2, Asperger's syndrome. Number 3, childhood disintegrative disorder. Number 4, Rett syndrome. And number 5, pervasive developmental disorder not otherwise specified. Many children ended up in the category of PDD-NOS, pervasive developmental disorder not otherwise specified. And these were children who met criteria in 2 of the 3 domains. The 3 domains being social reciprocity, language, and patterns of special interest, behaviors, and activities. Nowadays, we are talking about children with pervasive developmental disorders as having autism spectrum disorders, and that has its own new set of letters called ASD for autism spectrum disorder. Now, nothing has changed. Autism spectrum disorder, pervasive developmental disorder are the same children. It's just the categories have changed somewhat. The new category of autism spectrum disorder is being studied, and a new evaluation criteria will be set in the coming months or in the next 1 to 2 years. And that's the DSM-5. It has not been released yet. Some information is available about it, and we really do not know exactly what the final version is going to be. But it looks like it's going to focus more on the entire spectrum of autism spectrum disorder and not on specific categories. Certain children who were in the pervasive developmental disorder category will no longer be in the autism spectrum disorder category. And likewise, there are children who have other neurodevelopmental problems who have autistic-like behaviors but do not have autism. They also will no longer be in the autism spectrum disorder category. They will have autism symptoms. Now, why is this important? The most important thing for you to understand as a parent is that all children who have autism spectrum disorder have problems in 3 areas. They have problems with their level of reactivity, their level of regulation, and their level of flexibility. Regulation, reactivity, and flexibility. If you understand your child's profile in these 3 areas, you will understand your child's strengths and weaknesses. In addition, if you understand your child's profile in terms of the domains of social reciprocity, language development, and patterns of special interests, behaviors, and activities, you will understand how your child will have the diagnosis of autism spectrum disorder. The focus is now on, and for many years has been on, the development of the strengths of these children with autism spectrum disorder and not their weaknesses. Our focus has always been on identifying high-risk situations that cause them stress and strain, avoiding these high-risk situations, and teaching them techniques they can use to allow them to tolerate situations which cause them frustration or discomfort. The second thing we've always done is to focus on the development of social reciprocity. That's the ability to perceive the intent, purpose, and meaning of others. And we do this nowadays through social stories, through checklists, and even through the use of the new iPads, which are fantastic in terms of their ability to get children who are visually directed to interact in a visual fashion. Children who have autism spectrum disorder frequently are auditory weakness people. In other words, they have trouble with auditory learning, and they are visual strength people, meaning they are very good at visual information. iPads and other types of augmentative strategies can allow these children to interact in a more visual fashion rather than an auditory-based fashion. So social reciprocity training is vital if we're going to be successful long-term. The third area is to focus on job opportunities. And the key thing is to develop a skill set and an interest in a job opportunity that will allow your child, as they move into adolescence and young adulthood, to thrive and to be able to find a job that they are passionate and inspired to perform. In order to find that, they have to develop these skill sets early. So if you have a child with autism spectrum disorder who has specific interests, whether it's in geology or photography or dinosaurs or science or the History Channel, we recommend strongly that you develop those skill sets as much as possible, because they're going to provide you and your child the opportunity to thrive in a job position later in life. All of your activities should be focused on having your child develop happiness as one of their skill sets as they age. And the third area is what's called executive function processing. Children with spectrum disorders have problems with selective, shifting, and sustained attention. So we have to do everything we can to help them with their organizational skills, because sometimes they act more organized than they are. And the reason is because they tend to overfocus. They tend to see things specifically. In other words, they see the trees and not the forest. They see the chapters and not the book. They see the files and not the file cabinet. They tend to overfocus, and in so doing they become fixated on certain patterns of behavior or certain responses, and they tend not to look to other opportunities. And they have to learn how to do this if they're going to function day to day in a job opportunity. So they have to be taught through checklists and organizational skill development how to have the executive function to allow them to thrive and prosper in their jobs. So when we talk about children with autism spectrum disorder, we are talking about children with pervasive developmental disorders. The initials have changed, the names have changed, but the children, the adolescents, and the young adults have not changed. These are individuals who are diverse, and they're sitting, they are waiting, and they're asking us for their help, and we want them to give us their help to develop and provide society with all the skills that they have, focusing on their strengths and never focusing on their weaknesses.